Hi, my name is Stewart. I'm an assistant professor in interventional radiology at UCLA, and today I'd like to tell you about 5 things you should know about uterine artery embolization. Just a little about me. I received my medical degree at Stanford, and then I did my internship at Harbor, UCLA. After that, I did my residency in diagnostic radiology at Duke University Hospital, and I did specialized training in interventional radiology and a fellowship there as well. After that, I spent 3 years on faculty at UNC, where I specialized in women's interventions, and since then I joined the faculty at UCLA. So what are uterine fibroids? These are benign growths of the smooth muscle of the uterus. They're not a cancer, and they're very, very common in women, presenting in 70 to 80% of women by age 50. Only 25% of women with fibroids are symptomatic, and no treatment is needed for fibroids that are asymptomatic. Some women can experience severe symptoms, however, and these fibroids do regress at menopause. So there's a variety of different symptoms that can occur depending on the location of uterine fibroids. If the fibroids contact the inner lining of the uterus, then that can cause very heavy bleeding that can even result in anemia. If they're large or on the outside of the uterus, they can cause bulk symptoms, including pelvic pain, heaviness, bloating, urinary symptoms, or bowel symptoms. What options are there for treating uterine fibroids? Watchful waiting is an option if your symptoms are not very severe. Surgery and medications are also options as well. And then there are several minimally invasive treatments that can be used, including uterine artery embolization. So what is uterine artery embolization, or UAE? This is a minimally invasive treatment that uses small particles to block the blood vessels to the fibroids and cause them to die. This treatment has been offered to patients for over 25 years and is very effective. So there are 5 things that I believe you should know about uterine artery embolization. The first is that UAE is a whole uterus treatment for all of your uterine fibroids. So the uterus gets blood primarily from the uterine arteries, one on each side of the pelvis. And so what we do with UAE is we administer particles into each uterine artery, and that usually treats all of the fibroids in the uterus. Luckily, the uterus has other blood vessels in the pelvis that helps to keep it alive, so we're essentially only killing the fibroids and not the uterus. This is an example of a uterine artery embolization where we're doing an arteriogram with contrast so that we can see the arteries in the pelvis. This is an example here of the uterine artery, which is curly, arising off the internal iliac artery in the pelvis. In this patient, you can see that I'm injecting contrast into the uterine artery, and this kind of round ball with abnormal curly vessels is actually the fibroid. So what we're going to do is shut down the blood supply to that fibroid. And this is a drawing that depicts this. Basically through the small catheter, which is about the size of an angel hair pasta noodle, we were putting small particles into the uterine artery to kill the fibroid. Another thing you should know is that UAE is minimally invasive. So this procedure is performed in an angiography suite that's kind of like a cath lab. We use X-ray or fluoroscopy, which is like an X-ray movie, to visualize the blood vessels by injecting contrast into the blood vessels and seeing how the blood flows in real time. We access through a pinhole-sized site in the wrist, and afterwards we close it with an inflatable wristband. So there's no big incisions, and you can be back to your normal activities in about a week. This is an example of the wristband that we inflate after the procedure to obtain hemostasis after the procedure. Another thing to know is that UAE does not require a hospital stay. So pain after the procedure to some degree is expected. This can last up to 5 to 7 days, and it's related to the death of the fibroids. Naturally, that would cause pain. However, we have multiple pain control methods that can help patients get home the same day and still be comfortable. So we have various pain and nausea medication regimens that we can use. And one thing I do for all of my patients is a nerve block, which numbs the area of the uterus and gets you through the worst of it. This is an example of a nerve block that I'm doing on a patient. And I'm basically, this blob here is numbing medicine that's right on top of the nerves that go to the uterus. And for most patients, this pain after the procedure is very manageable. So another thing you should know, the fourth thing, is that UAE is very effective for bleeding and bulk symptoms for uterine fibroids. So for bleeding symptoms, UAE is around 90% effective, and most women would recommend the procedure to a friend. Full response is usually seen in about 3 months with bleeding symptoms. For bulk symptoms, it's around 80 to 90% effective as well, and full response usually takes about 6 months after the procedure. This is an example of a patient that had a very large fibroid. So this is a slice through her abdomen looking up as from like the bottom of her body. This is the fibroid here in white, this mass. And you can see, so white kind of means alive on this MRI. And then after the treatment, you can see that the inside of the fibroid is completely dead, and this will continue to shrink down over time. Another thing to know is that pregnancy is still possible after uterine artery embolization. So fibroids may cause infertility in some patients. There's limited data on pregnancy after uterine artery embolization, but there are many successful documented pregnancies. There are several factors to consider when choosing a treatment if you desire future fertility. So I do recommend consulting with your interventional radiologist as well as your gynecologist to choose which treatment would be right for you if you desire future fertility. So in summary, uterine artery embolization is a minimally invasive, image-guided treatment for uterine fibroids and adenomyosis offered by interventional radiologists with no hospital stay or extended recovery required. And this is a whole uterus treatment that's very effective. Thank you very much. Please reach out to our interventional radiology schedulers at UCLA if you would like to see one of our expert physicians.